Now, pivoting back to the pandemic, we also are expecting some new regulations from the CDC, some new a potential reversal from their mask mandate that they issued just a couple months ago, which is that they are now recommending vaccinated people to actually start wearing masks indoors again in certain circumstances due to just the potency of this Delta variant. You are a doctor. You have been in the ER. You have been administering vaccines to many people throughout this pandemic. Do you think that this is the right call?
Mariana, you said it. I'm an emergency medicine physician, and I'm a trained expert in public health, especially public health crisis, emergencies, disasters. And I have already, in my personal life, implemented the wearing masks indoors, and for several reasons. One is because the Delta virus is that much more contagious, and we're seeing cases of breakthrough infections, even hospitalization for individuals who have been vaccinated. However, I must say that 98% of those that are hospitalized are people who have not been vaccinated. So the vaccine does provide a significant amount of protection. We're starting to see breakthrough with those that have been vaccinated. And many of those infections of people that have been vaccinated are still mild and don't need to be hospitalized. However, they have active infections and they can be contagious to other people. So they can act as vectors, which is another reason why I've started to wear masks indoors, is because I have 6-year-old twin daughters and they're not vaccinated. So I don't want to bring anything home. So I do think that it's not necessarily a reversal or contradiction of a policy. It is matching the current state of infection rates in those localities that have increasing rate of infection or case rates per day or the average per week. And I do think that it is appropriate if you're in a county or in a location where the Delta virus is starting to increase in terms of positivity rate, if we are starting to see a increasing slope rise in hospitalization rates, that it is appropriate to start implementing these precautions once again, because don't forget that whatever you see now is going to be the trend for the next 2 weeks. Whatever you act on now for the precautions isn't necessarily going to take that much of an effect until 2 weeks later. That's just the nature of how fast the coronavirus is spreading, and it could even take 3 weeks just because the Delta virus spreads that much faster. And so we really need to think 2 steps ahead or 2, 3 weeks ahead in what we recommend.